My name is Dr. Lee, and I've been delivering babies for about 17 years now. 12 of those years have been in Enid. I'm an obstetrician, gynecologist, and do all types of women's health care. People ask me all the time, how many babies have you delivered? And it's probably around 3,000. That's just a rough estimate. There were a few years in there that I didn't keep track, but it's a really rewarding specialty, and I love doing it. The other part of my job that I really strive to do well is to be available as much as I can humanly be available when a woman goes into labor. I have always felt like when patients make an appointment to see me for the first time, they expect that I will be there to take care of them when they're in labor. And so I make every effort to be there. There are times I can't, but most of the time I can do that. And I really try hard to do that. And you'll find the other two doctors that we have here too also make that effort. And so that goes a long way with patients. I think it just shows them a great deal of respect that we try hard to be available for them all the time. Obstetrics and gynecology involves a wide range of issues that women can have, not only just being pregnant and getting good obstetrical care, but the gynecology aspect is very large. That encompasses things like abnormal bleeding or infertility, maybe an abnormal pap smear, something along those lines. And so an OBGYN has lots of skills that can take care of that. One of the things that we do, that I like to do, is robotic surgery. I think that is a very unique tool for women that need a hysterectomy. What we're seeing with the robot is increased recovery times, fewer complications. A lot of people go home on the same day after a hysterectomy, which is pretty unheard of. So we have more and more people doing that. That's a really unique, minimally invasive surgery that we're offering here. Our obstetrics department at our hospital is excellent. I know a lot of people think they got to go to the city to get the best prenatal care. I'm telling you, we have the best there is in this hospital. 3 doctors we have here do an outstanding job. High-risk deliveries and high-risk patients, we handle that stuff all the time. So don't feel like you've got to go down to Oklahoma City or some big place to get exceptional care. We can provide that here. The other thing that I would like to highlight is our C-section rate. This goes unnoticed a lot of the time, but our hospital prides itself on our low C-section rate. All 3 of our doctors here feel like nationwide, there are way too many C-sections that are done unnecessarily. We pride ourselves in having a low C-section rate, and that goes a long way. I think patients are comforted by that, knowing they're not going to have a unnecessary surgery. St. Mary's birthplace is top-notch. I would put it up against any labor and delivery unit in the nation, and that stems from good leadership from the very top. Our nursing director does an outstanding job making sure that all of the nurses are educated and know how to use all of our instruments and devices that we have. They are constantly doing educational things to make sure they are on top of their game. And that shows when it comes down to patient care. I think our nurses are excellent, and I think that truly is what separates us from any hospital. Our nurses are very compassionate. They spend a lot of time with patients, taking care of them, explaining things to them, and our nurses are exceptional.